Hi, my name's Jordan Reeves, and I had shock for my signature assignment. So, what is shock? Shock is caused by is a medical emergency that is caused by inadequate blood flow. It causes a severe drop in blood flow and it does not allow the oxygen to be delivered to the organs and the tissues as it's supposed to be. Which, with the decreased oxygen, it can cause cellular dysfunction. Without treatment, shock can progress to organ failure and unfortunately even death. The anatomy of shock, there's four different kinds that we'll learn about. There's hypovolemic and cardiogenic shock, which is caused by a loss of blood or fluid, so hemorrhage or dehydration, which causes low blood pressure. Occurs when the heart cannot pump enough blood to the body, which can also cause a heart attack. Obstructive and distributive shock results from a physical blockage in the circulatory system, so pulmonary embolism or cardiac tamponade. This involves a massive vasodilation, so expansion, of the blood vessels, resulting in low blood pressure, despite adequate blood volume. So something's blocking it, even though the blood is circulating and flowing the way it's supposed to, there's something in the way, it's not letting it go through. Septic shock caused by a widespread infection, so someone maybe has pneumonia and it wasn't treated or the antibiotics weren't working, and that can cause them to go septic. Anaphylactic shock is a severe allergic reaction, and neurogenic shock is caused by a spinal cord injury. Some more on the anatomy of shock. These are some of the systems that kind of get affected with it in a photo just to kind of help break it down. Central nervous system, the respiratory system, the hepatic system, so our liver, cardiovascular system, the renal system, and the hematological system, so all of the blood that flows through. Like I said, there's the four different kinds, and these are the systems that it will primarily affect. Some more continued on the physiology is the cardiac output, which is very, very important. So it's the heart rate times the stroke volume. So it just tells us that there is an adequate amount of CO2 being maintained by the tissue perfusion in the oxygen delivery. The blood pressure gets maintained by the sympathetic nervous system, the baroreceptors, so the aortic arch and the carotid sinus in the heart, and then the renin angiotensin aldosterone system is also very important in helping regulate the blood pressure. Physiology continued, oxygen delivered. It depends upon the hemoglobin levels, so blood levels, the cardiac output, like how much is your heart having to work, like how hard is it having to work to provide blood to the places that it needs to take the blood to, and arterial oxygen saturation. So how well are you being able to breathe on room air? Are you needing support or are you, where are you at? Cells use oxygen for ATP production via oxidative phosphorylation. Compensate compensatory mechanisms. So let's see here. So the sympathetic nervous system releases the norepinephrine, which then causes the vasoconstriction. So it closes it really, really tight. The B1 receptors then activate and then they activate the heart rate. They're like, something's wrong. And then they contract from the RAAS system, which we talked about earlier. And then that tells sodium and the water to hold, like, keep everything inside because something's wrong, makes the blood volume go up and the ADH and the water retention to maintain the blood pressure. Pathophysiology of shock. The hypovolemic shock is caused by blood or fluid loss. It causes the downwards of the preload, which then the stroke volume and the cardiac output also go down. The compensatory tachycardia and the vasoconstriction. So again, it's like really tight. It's making it really hard for the blood to flow through that small little hole. It's normally like this, and it's probably like this. Leads to cellular hypoxia and lactic acidosis. Cardiogenic shock causes heart pump failure. Oops. Oh, let me go back. Yeah. Which causes heart failure and can cause a mild infarction. So there's inadequate volume present, there's enough blood, but the contractility, so it's constricting, it's going down, right? So then the preload is going down as well, so forward flow. Pulmonary congestion may also occur. Distributive shock, septic, anaphylactic, and neurogenic. So severe vasodilation, really, really, really big vessels, right? Systemic vascular resistance, so the blood pools in the periphery. And so in septic shock, the cytokinase releases the endothelial. Once the cytokines release, they are damaging the endothelial. The capillaries then start to leak fluid, and then this can cause edema, which is like the really, really swollen legs or arms or obstructive shock is a physical obstruction, PE, cardiac tamponade, and a tension pneumothorax. So something's blocking it. That's why it's having a hard time. So the venous return goes down as well, and then that makes the cardiac output also decrease. Diagnosis, treatment, and AI. Diagnosis is a hypotension or a MAP of 65. So if a MAP that's greater than 65. So if the blood pressure has that MAP of 65, then and you're already in the hospital experiencing other symptoms, they're probably going to be more worried about shock. Tachycardia, like we talked about, high blood or high heart rate, elevated lactic levels, decreased urine output. Your body's like, oh my gosh, what's going on? It's trying to save everything, and it's slowly taking away the things that it doesn't think that it needs to try to survive in the moment. The ABGs, the metabolic acidosis, the air blood gas. So hypovolemic, IV fluids, crystalloids are used for treatment. Blood transfusion may be also needed or maybe used if needed. In cardiogenic, they do intratropes, dobutamine, which is a B1 antagonist, vasopressors, which is a norepinephrine. So have heard a lot that people in the ICU, they talk about people being on a lot of pressors, and shock can be one of those factors. Revascularization, PCI for an MI, so can help with the myocardial infarction, and then steroids. Some more treatment continued. Septic, they do more of the supportive care, broad spectrum antibiotics, IV fluids, vasopressors. Norepinephrine is that first one in line. Anaphylactic is epinephrine, so A and B antagonist, and an antihistamine. Why the side effects occurs because the vasopressors can cause excessive vasoconstriction, make it really, really tight, which can cause ischemia, like allowing no blood flow to go through. Intratropes are the arrhythmias, the B1 overstimulation. Steroids can cause immunosuppression. AI is helping because they're trying to be able to detect sepsis earlier. So predictive modeling, like, oh, if this, and this are happening, this person might experience shock. AI assisted ICU monitoring system, so things that can help monitor their patients while nurses are taking care of other people. Like there's a system that monitors their map to help the nurses know. Machine learning predicting the mortality rate, and clinical decision support system for vasopressor titration. So when they're in the ICU and they're getting these medications, they have to either titrate them up or titrate them down. They like can't just give them, there's a base dosage, but they have to slowly titrate them up to max and then slowly try to titrate them down to a lower thing so they can come off the presser because sometimes they're sedated and intubated. Demographics, the septic shock, most common is in the ICU. They're in the ICU for it. It's a higher risk for the elderly, the immunocompromised, and people who are diabetic. The mortality rate is 20 to 40%. Cardiogenic shock, common after acute myocardial infarction. It's higher risk in older adults and history of CAD. So if you already have had issues with your heart, unfortunately, you're at a higher risk for cardiogenic shock. 40 to 50% mortality. Hypovolemic shock is trauma patients, post-surgical patients, and severe dehydration, so in elderly and infants. So like trauma if you're in a car accident, someone just had surgery and their body's reacting in a way, sometimes they can go into hypovolemic. Anaphylactic is more common in individuals with severe allergies and asthma. It's rapid in onset, but it's usually treatable with epinephrine to help open up those vasos again. Here's just a few photos to kind of go over it again, just to kind of like have a visual representation. Distributive is excessive vasodilation, so it's like really, really big and it impairs the blood flow. Hypovolemic, there's a hard time getting the blood to, it gets only down here, it's not going all throughout the body where it needs to. Cardiogenic is a compromise of the myocardial performance, and so everything is being decreased. Obstructive, there's something in their way. It's filling into the heart and it's pouring blood into the vessels because it's not able to perfuse the right way, so it decreases all outputs. Here's my reference page, and yeah, that's all I have.